MI is a particular way of talking with people about change and growth to strengthen their own motivation and commitment. So in that particular way, motivational interviewing is, a way of, getting starting to help people explore. And it's in many ways kind of trans diagnostic. Like the diagnosis isn't like the most important thing. People say that about CBT as well. It's not the most important piece. The most important piece is that we're having someone come and talk to us. And just to give you an idea of how folks are integrating some of these, ways of thinking, is I do a suicide intervention training. So since you're talking about self-harm, and I will talk about things like some really important protocol, like asking directly about suicide, exploring with people we do that first. We explore with people their signs and symptoms, so it makes sense when we ask about suicide, because you're telling me that nothing matters anymore and that you hate life and everything's hopeless. I'm really wondering, are you ever thinking about killing yourself? Right? Like that might be a way of, asking directly. And we're doing it as we've just summarized, right? Some of these ideas. And then once someone says, say someone says yes, we continue to have a conversation. And I might be using like these MI tools of reflective listening, of summarizing, of affirming, to help someone explore some of those issues around suicidality before I get to like action planning, right? Because the action plan would be a safety plan in this particular case, right? So you can see we're hitting all the touch points of like good, like self-harm prevention intervention, but we're able to have, these conversations using motivational interviewing to help someone engage, to get focused, maybe to find a reason to live. And that would be kind of the change part. Okay, so hopefully that helped in some particular way, but I just wanted to make sure that that you got that. Okay, just making sure I got questions here. Okay. And also going to say that with motivational interviewing, I have on a prior slide. Motivational interviewing is a very guiding approach. And what that means is that we start where someone is willing to start. Someone just comes in and like, I'm here because my probation officer told me I had to be here. That's fine. It's perfect for mandated people. So I often will have people ask me, can you use motivational interviewing for someone who's mandated? And my answer is always, motivational interviewing is the only thing I can use for someone with a mandate. Because, people come in and it wasn't their idea. They don't necessarily want to be here. So I often will, if you look at my slide here, start with a listen and follow, kind of give me understand what's going on. I can imagine this has not been fun for you. And I really try to listen and get a sense of where they're at. And I guide often through the listening and starting increasingly to kind of churn up and respond to what we call change talk, which I'll show you on the slide, which is, their words, their thoughts, their ideas about what they might do differently, right? So if the status quo is, I'm in a lot of trouble with probation, I've been in trouble with the law, for whatever reasons, then as we're talking, if they're starting to say things like, I really need to straighten things up in my life because I don't want to spend time in jail. I really want to be a better parent for my kids, that kind of stuff. I am like reflecting and building on those comments because I can move over to the right-hand side and become more directive and help someone potentially step into a place where they might be willing to do some change or practice some new skills. Once they're there, I can't necessarily do that right when they first come in because they're just not ready for it. So in that particular way, motivational interviewing is really around listening and following. It was really around guiding after we kind of listen and follow. So we're trying to guiding towards change as opposed to starting with an agenda, right? So often with DBT and CBT, there's a starting with an agenda. So we did talk a little bit about ambivalence, didn't we? In the stages of change. And ambivalence is that feeling two ways about or more about something. And ambivalence is really important because it tells us like where to start. So if I have someone who's really highly ambivalent, And ambivalence just goes through all parts of our life. It's part of the change process. But it helps me understand, is it important to start with these motivational kind of curiosities and exploring first? Or is someone ready enough for a change that they could, sign on for DBT or become involved in a CBT program? And often when people have a lot of ambivalence, it's really about pausing and listening and hearing both sides of the dilemma. And so as we're talking about this and you're thinking about dialectical behavior therapy, listening to both sides of the dilemma is a very dialectical process in and of itself. There's a thing that I don't want to change and a thing that I do. I've been out of school. I don't want to go back to school, but I want to graduate with my friends, right? Those things are both in tension right now. And so here's the way I look at this. We can think of ambivalence as a glass half empty, like, oh, this person is so ambivalent, they're never going to change. But I encourage people to look at it as half full. That actually the fact that someone's ambivalent means that they're moving away from the status quo. They're moving away from the status quo. And so this idea of, I'm thinking about, I've been out of school, I've been at home, I've been on my phone all day, refusing to leave the house. But if someone's willing to come and talk to me, and they're talking to me about, I'm kind of lonely, I'd like to be with my friends now and again, or I'm not sure what I'm going to do with myself, I can always frame that as, oh, what a mess, they're saying this stuff and they're at home. But instead I want to frame it as, that's potential. Right there, there's this status quo of staying home and being on the phone all day and not going to school is starting to feel uncomfortable. And that is a very important thing. So I'm noticing, and there's some specific questions here about like different types of communities. I'm just noticing like IBS, it's irritable bowel syndrome, and IDD. And, there are resources, lots of resources, probably all of these areas. Just because of the scope and timing of this practice, I might have to put those in a parking lot or encourage folks to, do a search at some point, because I just don't have the capacity to go off and to, start kind of researching that at this moment. But for many of these things, when we're thinking about anything that's behavioral or health care oriented, there's almost always some aspect of a cognitive behavioral approach. And again, motivational interviewing is being taught in medical schools now. So doctors, like working with someone with irritable bowel syndrome, let's say, like they know the importance of having a conversation with them, because just even with a slide right here, if someone has IBS, there's probably behaviors they're involved in that are not helping the IBS. Or maybe there's other things they could do, like stress management, that would help that. And they're just not doing it. And doctors are starting to learn, like they can prescribe whatever they want in terms of writing a prescription. But for so many health issues, folks actually need to do behavior change. So they're starting to figure out, helping people decide like what targets they want to use, like where are they willing to start, even if they're willing just to do one thing to change some aspect of their healthcare or behavior. So for a lot of healthcare issues, you will, if you start to look up, IBS and motivational interviewing, you will find resources also for IDD, intellectual developmental disorders, what I'm thinking you're talking about here. There absolutely we can use like kind of like all of these skills. We just may have to design them a bit differently, especially as we teach skill sets. Just may need to be more concrete and such, specific.